Welcome to Nursing Life Channel. Today we do third chapter of pharmacology. Drugs used in gastrointestinal system. First we go over through about digestive system. In the journey of digestive system, first food come in contact with mouth. Food enters the mouth, where teeth chews the food and turns food into small pieces, and saliva mixes with it to form bolio. Second, esophagus carries food from mouth to the stomach. Third is, stomach churns and mixes food with gastric juice, and we have some accessory organs like liver, gallbladder and pancreas which plays their important role in digestive system but not come in contact within the journey of food. Next, same as drug digest and absorb and plays vital role in our body. Pharmacology of commonly used drugs are emetics and antiemetics, drugs used for peptic ulcer disease, laxatives, drugs acting on inflammatory bowel disease. So, first we have emetic drugs. Emetics are drugs that induce vomiting to remove harmful substances from the stomach. Now, we have common emetic drugs. Ipecac syrup. Ipecac syrup acts locally on stomach and centrally on chemoreceptor trigger zone. Second we have apomorphine. Apomorphine acts on CTZ in medulla, centrally acting emetic. Next, we have mechanism of action of emetic drugs in human body. Emetic drugs plays important in inducing vomiting. Apomorphine stimulate vomiting center in brain. Ipecac syrup irritates stomach lining and sending signals to. Next, we have uses of emetic drugs. First is treatment of poisoning. Used to remove ingested poison from the stomach, only if substance is non-corrosive and patient is conscious. Ipecac syrup is used. Second is diagnosis purposes. Sometimes used in clinical test to study vomiting reflex or stomach function, rare in modern medicine, and last is to clear stomach before surgery or procedure. Occasionally used to empty the stomach before anesthesia or endoscopy, that is rare today. So these are all uses of emetic drugs. Now, we have contraindications of emetic drugs, means in which condition we avoid emetic drugs. First is unconscious patient. In unconscious patient there is a risk of aspiration. Vomit may enter in lungs. Second is corrosive poisoning. Example, acids or alkalis, as vomit may cause further injury to esophagus and mouth. Third is petroleum or hydrocarbon poisoning. Example, kerosene and gasoline. Patient may have risk of aspiration pneumonia. Fourth is seizure disorder or convulsions. It worsen the conditions if nurse may administer emetic drugs. Fifth is pregnancy. It may cause excessive vomiting if patient intake emetic drugs and patient will leads to dehydration. Sixth is severe cardiovascular disease. Vomiting increase strain in the heart, so avoid emetic drugs if patient has history of cardiovascular disease. And last is children under 6 months. It is not safe or effective for children under 6 months age. So above mentioned conditions are contraindicated for administering emetic drugs. Now, we have side effects of emetic drugs. First is nausea and vomiting, that can lead to dehydration and electrolyte imbalance. Second is abdominal pain and cramping, due to strong stomach contractions. Third is drowsiness and dizziness, from central nervous system effects. Fourth is hypotension, low blood pressure, especially with certain emetics like apomorphine. Fifth is bradycardia and tachycardia, irregular heart rate changes. Sixth is aspiration pneumonia, if vomit enters the lungs. Seventh is esophageal or gastric irritation, from repeated vomiting. Eighth is headache and weakness, due to dehydration and drugs action. And last is convulsions, seen with overdose and hypersensitivity. Emetic drugs like Ipecac syrup and apomorphine are rarely used today because of their potential risks and the availability of safer alternatives for poisoning management. Now, last we have role of nurse while using emetic drugs. First is, always check the conscious level of the patient. Second, confirm the type of poisoning. Third, do not use emetics if patient have alkali, acid and kerosene poisoning. Fourth, maintain record color and amount of vomit and take sample for laboratory investigations. Fifth, take the intake, output chart of patient. These all are about emetic drugs.